Today we'll be discussing dorsal hand rejuvenation using Sculptra and Radiesse. Dorsal hand rejuvenation steps: local anesthesia and skin preparation using both a topical and a nerve block, mixing the Sculptra, intradermal injection in 4 web spaces, massaging of the dorsum of the hand, and we place tight latex gloves, sit on the hands for 10 minutes, and then aftercare, and we're following doing a Radiesse injection technique. Here we're applying the topical anesthesia. We use a triple anesthetic, a topical cream using 20% benzocaine, 6% lidocaine, and 4% tetracaine. Well, for the nerve block, it's a superficial radial nerve block, as well as a block of the dorsal branch of the ulnar nerve. I use 10 cc's of the local anesthetic. Skin preparation is with chlorhexidine and alcohol swabs. Mixing of the Sculptra: take 1 vial of Sculptra and use 10 cc's of injectable bacteriostatic water at least 2 hours prior to the procedure. And we mix it the night before and just keep it in the refrigerator. In the time of the injection, we take the solution, a half a vial, and we mix that with 4 cc's of 2% lidocaine plain, so for a total of 9 cc's of injectate. We place 2 cc's of injectate in each of the web spaces. First we do a pinch of the skin between the metacarpal heads and make sure we keep doing this tenting so that we keep the injection just in the subcutaneous space. It also helps us avoid the dorsal veins and nerves. So once again, it's the tenting of the skin followed by the tenting as we inject only anterograde. We do not inject retrograde so that we avoid injury to the dorsal veins. Finally, the last web space. Often for the first web space, more injectate is needed, so I inject approximately 3 cc's into this space. Using a fan technique for the first web space. And finally, if there's any injection left over, also the dorsum of the hand at the CMC joint is a good place to add any of the extra injection. Just customizing the injection for small defects. Finally, using a bactericidal lotion, massage the dorsum of the hand for even distribution. Be certain to massage from proximal to distal to avoid massaging the injectate into the forearm. And place tight latex gloves and have the patient sit on their hands for 10 minutes. Now for the Radiesse clinical case. This is how we mix the Radiesse with the 0.2 cc's of 2% lidocaine with epinephrine, giving us a total of 1.5 cc's of injectate. To the first injection, we go to the second web space between the MP and CMC joints. You want to be immediately subcutaneous. Pinch the skin. Inject 0.3 cc's of the injectate. It does not flow easily, so you must continue. Use injection pressure as you inject. You get a nice bolus, and then you massage that bolus proximal and distal within the web space. Web space here. Once again, midway between MP and CMC joint, halfway down the metacarpal, right in between the metacarpals. 0.3 cc's of injection. Make a nice wheel subcutaneously, and you can see that it's superficial to the dorsal hand veins. fourth web space to the skin, immediately subcutaneous. 0.3 cc's. Raise a wheel. Spread the Radiesse throughout the web space. Lastly, the first web space, leave a little extra, half a cc. What do you think, Anita?
It's good.
If you had a little bit more to add, where would you put it? Maybe right here?
Right there.
Okay.
Mm-hmm.
Thanks. Massage with lotion to decrease the friction. This is also an antimicrobial lotion. This allows for even distribution of the injection in the web spaces. Place a tight glove. Have the patient sit on their hand.